So we're going to continue talking about managing pain in OI. And first up is Sophie Barlow from London in the UK. She joined the Royal National Orthopaedic Hospital in 2011. She has specialized in pain management and rehabilitation in 2013 and has been working alongside with the multidisciplinary team working with adults with OI for 3 years.
Thank
Sophie.
you. Lovely. Thank you very much, and thank you for the invite to speak to you today about therapeutic pain management principles in OI. I don't have any disclosures for this presentation. And for those of you that don't know me or didn't hear the introduction, I'm a physiotherapist working at the Royal National Orthopaedic Hospital in Stanmore. And part of my role is working in a multidisciplinary clinic with metabolic bone consultants, Professor Keane, who's spoken a couple of times this weekend, and our clinical nurse specialist, and another consultant, Dr. Boubier, who some of you may know as well. So we've heard a lot about pain, and musculoskeletal pain in osteogenesis imperfecta, and adults in particular, is a very big issue. We conducted a study in 2022 which demonstrated that 84% of adults with OI who attended our clinic over a 6-month period reported musculoskeletal pain. And 50% of those patients reported persistent pain that lasted for longer than a year. And on the diagram, you can see that it's widespread nature of pain reported, which again, I think links quite nicely with some of the other presentations that we have heard already, with the spinal pain being most prevalent. We also found that 45% reported moderate to severe problems with mobility in the EQ5D, and over 50% of our patients reported higher anxiety levels on the EQ5D. And we know that not all of this pain is related to fractures. It can also be down to dislocations, soft tissue injuries, as well as the altered biomechanics for our patients with OI. And up until yesterday, I would have said hypermobility, but every day's a school day. So living alongside pain impacts our daily function in multiple areas of our lives. And it can impact what we do for leisure, our relationships with family and friends, our mobility, what we are able to do for work or don't do for work, the quality of our sleep, and also our mood. And I like this depiction that everything's a bit of a juggle. And as part of our tertiary pain management service, we offer outpatient as well as residential pain management programs to enable people to live well alongside their pain. And from our study, 50% of those patients that we saw were referred into our therapy service. And that service includes a multidisciplinary team of occupational therapists, physiotherapists, and psychologists. And we know that all pain sufferers are different, and how we perceive pain is different. So the focus is really working together to achieve a patient's goals. So how do we go about doing that? And we've heard a lot about pain is a big issue over the last couple of days, but in the absence of a great one pill completes and helps all of us, what do we do? So within our pain management program, which is also very much inclusive to other pain sufferers, for example, fibromyalgia, complex regional pain syndrome, joint hypermobility, so anybody really that is living with and dealing with persistent pain. We very much look at some of the key pain management strategies which are delivered through teaching sessions or integrated into therapy treatments. And our aim is to provide information that people can use to identify where change might be able to occur within their daily lives to influence symptoms. So pacing or activity modification is a term that a lot of people will be familiar with. And it allows patients to identify whether they have more of a boom-bust pattern of behaviour, such as pushing through pain, and then crashing because of overdoing an activity. Or conversely, that fear avoidance, we know that actually an activity really increases our pain, and therefore we stop doing the things that we once enjoyed. So pacing is about modifying how we go about doing those activities. So it might be thinking about taking more rest breaks or using assistive devices such as wheelchairs or crutches, etc., to help us manage those activities in a different way. And people may find it useful to plan activities using activity diaries and potentially that traffic light system to understand the demands of what activities have on our bodies. So a red activity being highly demanding and a green activity being an opportunity perhaps to recharge. And then amber is somewhere in the middle. And in order to do this, we need to understand what our baselines are and our tolerance to an activity, therefore creating a more consistent activity level throughout the day and the weeks and the months. Moving on to stress management, we now have many stressors in our modern life, and when we're living in pain, our fight or flight response may be heightened or more sensitive, and learning how to tap into that relaxation response or the parasympathetic nervous system is really important to reduce our stress hormone cortisol and increase some of our happy hormones, our endorphins. And when we do this, our energy can be conserved, and we might notice an increase in alertness or perceived ability to cope with our symptoms more readily. Our occupational therapists do discuss sleep, and that enables patients to understand a little bit more about what sleep cycles are and how perhaps they can influence that to improve the quality of their sleep. And that might be things like positioning, for example, or using meditation before bedtime, or having just simply a better bedtime routine. But we know when we sleep better, we feel more refreshed and able to cope with the day ahead. So flare-up management, we know when we're living with a pain condition, flare-ups happen and they can occur. Sometimes we know what the triggers are, sometimes we don't. But what we talk about with our flare-up management is when your usual symptoms are so heightened that you're unable to go about doing your daily activities. And with inside that, understanding what those early warning signs are, what those triggers are, allows us then to put into practice or put into place a clear process when you're in flare-up and when your daily life is interrupted by pain. And that can help us have a better sense of control on a particularly unpleasant point in our day. Some people also make flare-up boxes with all the necessities they may need for a flare-up, so it's readily accessible for when they need it. And that might include a drink or a snack or a sensory oil that they like the smell of that helps them calm and helps them relax and manage their pain more effectively. And we also recognise that when patients have a better understanding of what chronic pain is and how complex it is and the different layers, that actually they might be able to identify which strategy they need to implement and at what point. And obviously this is a topic very close to my heart, exercise prescription, being a physiotherapist. And when patients either come on a programme or as an outpatient, we will offer an individualised assessment looking at range of movement, often strength, but also how your muscles move within function. We'll also consider a patient's confidence in movement and activity, because that's also something that we recognise that over time can be disrupted or at least be reduced. And that can help us start the process of exercise prescription at a level that is acceptable to that individual. So following the assessment, we'll work together to find ways of increasing physical activity that that person enjoys doing. And as we know, no one size fits all with OI, so we have to get creative. And we'll consider what equipment is available to that person and what they're able to access, as well as the socio-economic status, and able, again, to come up with a plan that's acceptable to them that they can engage with on a more regular basis, taking out some of those barriers. So we also consider how often they can do the activity and work out baselines using a graded approach. So we often ask patients to reflect on how movements feel and if they can influence this with breathing, for example, or simply just changing the way in which they do a movement. And that can be quite powerful and a way to increase their control over what the symptoms are telling them at any given time. But in order to promote behaviour change and the long-term physical habits, we try and integrate the concepts of pacing and try and also understand what motivates a person to continue with their activity and what impacts them. And empowering patients to take control of their exercise routines by providing progressions when things are going well, what can they do next, how to change it up a bit. It's quite boring doing the same thing all the time. But also, when you have had a flare-up, or perhaps at those times when you think, oh, I just need to get started again, what regressions can we use and where can we start from? And again, it's all about empowering patients to be able to do this as best they can. So I mentioned using the breath to help with movement, and this is a skill that we introduce within sessions, as well as implementing different relaxation techniques. We do encourage this mindful movement, which is really about paying attention to how your body is feeling. And we heard yesterday that actually this can be quite tough when we're filling out pain diaries, for example. Really focusing on what we're feeling can be very uncomfortable, especially when those sensations are very unpleasant. But actually what we're hoping to achieve is a bit more of an acceptance of what our body is saying and listening to that in the present moment without judgment, and trusting that our body, and thinking about how we can then influence some of those feelings and the sensations that we are feeling. So for example, if your muscles are really guarded, they're working harder to support you and to be in that particular position. So can we focus on allowing the breath and the movement just to relax some of those movements and take away some of the secondary suffering that we might be experiencing? And again, in turn, creating a bit more control, a bit more influence by playing with movement, by exploring our movement a little bit more, so it's not quite so black and white, giving us tools and empowering people to influence and change their symptoms. So during our inpatient programs, patients will be offered a psychological assessment, and if required, they will receive treatments that are based on the cognitive behavioural therapy, as well as attending group sessions about communication and assertiveness. And if further treatments are required, they can signpost to appropriate services, but as we have heard today, they are few and far between, and we recognise that that is a limitation. So in conclusion, we know that musculoskeletal pain is prevalent with adults in OI. Our therapeutic pain management strategies, which we're using already for longer-term persistent pain conditions, are skills which support patients to live well alongside their pain. And our therapy programs aim to empower patients to make lifestyle changes. But what we don't know at the moment is the impact that's having on our OI population. We know that we are putting patients through the program, and often, anecdotally, they are telling us that is really helpful. But ideally, we want to have that in writing and to think about our further research. So I would like to thank all of my colleagues on the pain management and rehabilitation team who do an amazing job every day, and the Metabolic Bone team, and also the Brittle Bone Society for sponsoring our study. So thank you very much. I'm sure we've probably got time for questions.
Thank you.
Thank you.
We do have time for questions, so I see one over there.
Hi, that's wonderful. Thank you very much for
you.
sharing. I wanted to know, do you need to coach individuals in how to practice mindfulness to get them to really understand how to do it? I find for some, it's very difficult to start the process.
Yes.
Can you explain how you coach them a little bit?
Yes. So education, I think, is number one. Why is this helpful to me? I use it myself, and I think actually using my real life experience can be quite helpful to patients as well. So as a team, we actually do Mindfulness Tuesdays, and we do 15 minutes of mindfulness as a team. Obviously, we can't always be there, but in order to practice it well, I think you have to you have to understand and you have to do it yourself. That would be number one. So we have a group session that explains what mindfulness is and mindful movement in particular. And then we often do it one-to-one with a patient. So whilst we're doing it in a group, as part of our pain management program, actually maybe going a bit off-piste with that script a little bit and just making it pertinent to them. And, it's a skill and it needs practice. And if people don't practice it, then it's not going to be useful. But if they don't see the value in it in the beginning and you can't get that kind of acceptance and acceptability as that as a skill and useful, then we sometimes don't use it.
Okay, one more question. Yes.
Yes, he's from Denmark.
Hi.
The mindfulness part, do you have a step, do you have active mindfulness, like walking mindfulness or moving, like there's some who is in so high arousal that they can't go down to the mindfulness?
Yes.
They have to do you have some steps and which?
Yes, it's a good question. And again, it's not a one size fits all. And I think that's where the individual doing it together on an individual one-to-one basis can be quite helpful. And we do have patients that say, I can't do that. But actually what we find is when we do shorter sessions, we kind of introduce it, we use that education to help them understand why it might be helpful. That's when you start to get a bit of buy-in. Thank you.
Okay.